Okay, so let me get myself situated. So welcome everyone. During today's presentation, I'm going to orient you to our second edition of the Risk and Reach report and direct you to the website, highlight some key messages, and spend some time answering your questions. We're also going to cover the findings of the Fiscal Scan of state investments in early childhood during the last segment of the webinar. And I'd like to invite you to ask questions throughout via the chat so I can integrate responses during the presentation, but we will also have some time towards the end dedicated to Q&A if we are just bombarded with questions here. Okay, so let's go to the next slide. We want to do a little poll and, ask you to kind of identify what's your, primary role. I know we have multiple hats that we wear, but for the most part, what's the role that is kind of motivating you to be in this webinar? While you do the poll, I'm going to introduce myself. I'm Cristina Passioni-Sayas, serving as the Senior Policy Advisor of Erikson Institute, and have some other colleagues from Erikson joining, Luke Bandic and Veronica Vidal. And so we are curious to see who else is on here, and I'll be introducing our partners shortly. But if you can just go ahead and click on that poll. And how are we doing, Luke? Do we have pretty much all of our answers?
We got a good number of people who have responded. Lots of advocates, a couple funders, community residents, parents, caregivers. But let me share the results. So yeah, lots of advocates in the house today.
Per usual, the advocates come through. That's what we're talking about. Okay, so let's go on to the next slide here. And, we actually, when you register, we ask a question because we're kind of curious, right? We don't just curate data for the sake of curating data. We want to know, how are you applying the data? How are you putting it to action? And for the folks who registered, in terms of their responses with respect to how they have used the Risk and Reach report of the past, these were your responses. And so obviously, we can see majority responses around the collaboration piece in terms of it fostering collaboration, informing your advocacy efforts, as well as your organizational priorities. There were other responses in terms of, being able to use this information when interacting with policymakers, in terms of research reports, and incorporating the data into your proposals and grant reports, and also even inform some program changes. So that's great. Keep this in mind as we are kind of going through the information here. So let's go to the next slide. Because before we get started, I really would like to acknowledge the partners who lent their expertise to produce this report. First, we have the Illinois Early Childhood Asset Map at the University of Illinois in Urbana-Champaign, and the Fiscal Policy Center from Voices for Illinois Children, now which is a part of the YWCA Metropolitan Chicago. I'm delighted that our colleagues who comprise the core partners are joining us on this webinar to field questions, as well as to present portions of this webinar. From ICAM, we have Keith Hollenkamp, who's the Assistant Director, and from Voices, we have Mitch Lipson, who's the Director of Government Affairs. Of course, this project would not have been possible without the generous support from our funders, the Irving Harris Foundation, the Pritzker Children's Initiative, and also through a preschool development grant, the Birth to 5 sector, through the Governor's Office of Early Childhood Development. And lastly, I really want to acknowledge our illustrious body, the Advisory Council of 40+ stakeholders who represent the public and private sectors across the state. They provided us the feedback that ensured the report would be relevant, it would be timely, it would be accessible, all of that to meet our ultimate goal of that it's actionable, not a report that just sits up on the shelf collecting dust. So I want to just go to the next slide so we can kind of level set. Some of you all are obviously familiar with the Risk and Reach report, but just want to cover this real briefly. And so what do we mean by risk and reach within this report? You see right there that, risk are the factors that undermine optimal child development. Reach is the publicly funded programs and services that support early childhood well-being. And I want to kind of note here that the publicly funded is only inclusive of state and federal funding that we appropriate. It's a report that is a curated data set. And it provides this comprehensive snapshot of child well-being. In a few minutes, I'm going to go through the summary of indicators and how we chose them. And so we produce this report every 2 years, and this is the second iteration, featuring what we know as pre-pandemic data, so from 2019, unless we note otherwise. And, just again, to level set, because there's usually a lag in availability of state data to be made public, this is the most recent data set that's available. And it also, the reason why we went with pre-pandemic versus pandemic is because at the time when we were putting the report together, there were concerns over the quality of the data potentially being compromised because of disruption of services, because of limited capacity, so on and so forth. And so the next iteration of the report will definitely be able to show us impact of the COVID-19 pandemic. So let's go to the next slide. So, back to your poll in the beginning, what did you do with the data that was shared in the Risk and Reach report? These are the ways that we have been able to kind of capture how the report can inform policy and program funding decisions made by local and state government, as well as non-governmental stakeholders, ultimately for the goal of facilitating greater equity for Illinois young children and their families, and allocation that is appropriate to meeting those equity goals. And, it's designed to evaluate how well we are reaching children experiencing risk factors in specific geographies. It's also designed to help communities better understand the allocation of resources in early childhood programming gaps and needs, and to inform decisions regarding policy practice and funding affecting early childhood. So let's go to the next slide. Because this report's focused on young children, let's provide some context here by examining the 2019 total state population disaggregated by race ethnicity. So you'll see here we have 12,671,821 individuals that were captured in the total Illinois population, and you see the breakdown of race ethnicity. I want to point out this iteration of the report, we were able to disaggregate a little bit further, because in the past report, we actually smushed together some of the data, the disaggregated race ethnicity data that related to Asian, Pacific Islander individuals, as well as 2 or more races into the other category. So we were able to extrapolate Asian, non-Hispanic, and so we're glad we're able to kind of call that out. Let's go to the next slide. So the report, is, as I've mentioned, focused on children age 5 and under by race ethnicity. This is the same data year. And as you can see, I'm sure you noticed that the race and ethnicity breakdowns reveals a greater diversity in our young child population. In total, we now have 916,880 children under the age of 5. And let's go to the next slide so we can see where these children actually are concentrated by county. So what you have here is a heat map that shows you by color grade the concentration of children 0 to 5 by county. Young children make up 7.24% of the 12.6 million residents of Illinois. As you can discern, the darker the blue, the higher number of the children age 5 and under living in those particular counties. So let's go to the next slide. We wanted to kind of give you a snapshot here, something to kind of pay attention to in terms of, how many counties fell in each of the risk categories in the comparison from 2019 to 2016. We have 102 counties. There's the 4 designations of low, moderate, high, all risk levels, overall risk levels, which we'll talk about a little bit further. And you can see, where the concentration of children live, which risk level of the counties. And as you can see, the majority of our children live in either high, moderate, or high risk counties. And so we've got some work to do in terms of moving that needle. But we've had some slight changes here, even though we've also experienced some population loss, which we'll get into in a moment. So I'm going to now walk you through the key takeaways. The report can illuminate the strengths, the opportunities, the trends related to how Illinois can and should support child well-being. And as you read and make sense of the report, make meaning of these data, a key recommendation that we would like you to consider is to engage in dialogue with diverse stakeholders and local leadership to gather the appropriate context for interpreting the data, making meaning of the data, especially as you are informing action plans at the local and state level. Given that we have now 34 indicators, we're up from 32, the last report. I'm going to just highlight a handful of the salient changes in data from the last report, because we also kind of want to give you a little bit of a tease so you actually go download the report and check it out yourself. Okay, so let's move on to the next slide. So in 2016, that child population slide that I just showed you. Now what I'm going to show you are some comparisons from 2016 to 2019. So 2016, there was an estimated 945,752 children under the age of 5. In 2019, that number dipped to 916,880. Illinois has seen a 3% decrease in child population under the age of 5, and the state has been experiencing a general population decrease, so that's not totally surprising, but it also, something to kind of consider specifically for this particular population is, we've had a downward trend over the past few years in the state's birth rate. And we also know that because these data are sourced by the census, there has been a historic undercount of children 0 to 5. So it could potentially be attributed to both of those factors as well as others. Let's go to the next comparison slide. So poverty. The state rate of children aged 5 and under living below the 100% federal poverty line in 2019, that was 18.79% in 2019 compared to 21.5% in 2016. Something to note, because what you'll see next to the maps are the little kind of peaks and valleys, right? These little pyramids. This is the disaggregated data by race, ethnicity, and you'll notice these in our slides so that we can kind of get a deeper picture of what's happening, right? It's one thing when we're looking at it as a state snapshot or a by county snapshot. It's a whole nother story when we start to kind of peel back layers and look at it with respect to race and ethnicity. And so something to kind of note in terms of the distinction between 2016 and 2019 is the percent of Black and Latinx children aged 5 and under are experiencing poverty decreased by 6 and 3 percentage points respectively since 2016. However, they still experience poverty at significantly higher rates than other racial and ethnic groups. And in 2019, data show that 42.25% and 25.34% of Black and Latinx children respectively were living at or below the poverty level. Just to put this in sheer numbers, that equates about 57,332 Black children living at or below poverty and 56,060 63 Latinx children living at or below poverty. So significant. Just to also kind of put it into context, a cohort of children in Chicago Public Schools kindergarten is about 25,000. So you can kind of get a sense of that. So let's move on to the next comparison slide. Maltreatment. The state rate of victims of abuse and neglect and the rate per 100 or per 1,000 children aged 5 and under in fiscal year 19 was 19 per 1,000 children, 0 to 5, compared to 14 per 1,000 children in 2016. So obviously this is an increase, but I think it's also important to note that this data point may be attributed to an increase in reporting, either by families or the Illinois Department of Children and Family Services. Interestingly, in conjunction with this increase, the percent of children aged 5 and under in substitute care attaining permanent homes within 12 months slightly decreased by 1.9% in 2019. So thankfully, you know, some of the additional resources that the General Assembly approved in the budget and the governor signed towards DCFS can hopefully help mitigate some of these implications of these data points. Let's go to the next set of comparison slides. And so those first two were actually a part of the family stability domain. The report is broken up into 3 domains: family stability, health, and early care and education. And now we're looking at one of the examples out of our health domain. So this one was an interesting one too. The state rate of violent crimes per 100,000 people in 2019 was 393 compared to 436 in 2016. The key takeaway in this is that the state rate of reported violent crimes per 100,000 people decreased in 2019. And, you know, this is significant as, you know, children exposed to violence, whether it's in the home, whether it's in community, can experience post-traumatic stress, which can affect, obviously, development and have lifelong health consequences. But again, you know, a caveat to kind of consider is that this data point could reflect changes in law enforcement policy or reporting by the population or reporting by the Illinois State Police. Let's go to the next slide here. And so those were just a selection of risk slides and some comparisons that really like stood out to us as we were putting this report together. And now we're going to look at some of these reach indicators. So what you'll see here is developmental screening. This is the number of children aged 5 and under who received the developmental screening and were reported through Child Find in fiscal year 2019. There's been a significant increase in children aged 5 and under who were reported receiving developmental screenings. Fiscal year 2019, there were 109,149 children who received these beneficial screenings to assess hearing, vision, physical, coordination, speech, cognitive development, and social emotional skills, compared to 96,344 in fiscal year 2018. Again, important to note, this is a data point specifically on reporting because our state does not mandate putting these reports into a centralized repository, possible policy proposal. And so the increase could be attributed to better reporting. So we just want to point that out. The next slide looks at a reach indicator in the family stability section. And this is food assistance. So this is percent of income eligible children aged 5 and under receiving SNAP benefits in 2019. And what you'll notice about these reach maps is that the base of the map is an overall risk composite score, and then those yellow dots indicate the reach or the distribution of public resource. And so the larger the dot, the greater the reach. And then of course, when available, we do have the race and ethnicity data. And so the Supplemental Nutrition Assistance Program, known as SNAP, Participation for children under age 5 increased by 5.8% percentage points in 2019. And that'll be really interesting to also look at post-pandemic, given what we know in terms about, the economic instability that the pandemic created for families. But something to note is that the state rate of children in this age group receiving these benefits is 87.43% overall in our state, compared to 81.6% in 2016. And then the last comparison slide that we wanted to just kind of, point out is publicly funded preschool. This is under our early care and education segment. And so there was a decrease in the gap between available publicly funded preschool slots and number of children ages 3 and 4 who are eligible for preschool programs. So it dropped to 11,439 slots, that gap. So we have to close the gap. And in 2016, it was 30,466. So this is a positive, substantial shift compared to 2016. Just want to note within these data points, we are looking at state-funded programs such as the Preschool for All program, as well as Preschool for All expansion, and the federally funded Head Start program. And so, something to note, though, that again, when we're looking at data, we have to also look at some nuance and context. So in addition to the increase in the available slots, this data point can also be attributed to the decrease of eligible 3 and 4-year-olds, which went from 138,126 in fiscal year 16 to 122,331 in fiscal year 2019. And eligibility right now in this particular context is being defined at the economic threshold. So those were just some comparisons that, we thought some key takeaways to kind of highlight. We, punctuate them in the executive summary of the report. And I wanted to just kind of, again, give you a summary of some of the risk factors within the report that we typically cover, and some noticeable changes. And so essentially, as we've defined before, risk is defined as factors that undermine optimal child development. And those particular factors, let's go to the next slide. Something that I want to kind of really underscore is that, the report is designed to show you risk factors, but not at the individual level, not individual risk. The way that we're looking at risk is risk that's situated in the environment, specifically in systems and structures. And I stress this because during the report production, the Advisory Council made a conscious decision to reject traditional uses of the word risk, such as at-risk children, at-risk communities, and to really reframe this definition of risk to be situated in the environment of structures. And when we reject risk as an inherent trait in children, families, and communities, it directs us to locate risk in systems and structures and develop solutions that address root causes, because no child is inherently at risk. But children and families experience risk factors or structural barriers that undermine their development or ability to live up to their fullest potential. So the report visualizes the concentration of risk factors experienced by children and families by county, and is organized in these 3 domains, as I've previously mentioned. Family stability will always have a little purple hue to it, and then health is the green section of the report, and early care and education is the magenta section. And these particular risk factors were selected by the advisory council based on 2 criteria. One, we needed child development research to validate the indicator as producing conditions and circumstances that may compromise optimal child development. And 2, the availability of data at the county level. And something to note, you know, Illinois, because we just always got to go big or go home, is that, you know, risk and reach reports in other states that we had looked at to kind of help us with the production of this report, their total number of risk and reach indicators combined is anywhere between 12 and 15. Well, we have 34, and you know, it took some discipline to even whittle it down to 34. So I want to, you know, move us along to the next slide, because I want to make sure that too, as we're looking at these data in the context of comparing from the previous year to see how far we've come in terms of moving the needle on risk and moving the needle on reach, there's some caveats, and I'm actually going to call on my colleague, Keith, to give us some explanation here.
Hey, thanks, Christina. Hi, everybody. I'm Keith Hollenkamp from ICAM. And as Christina pointed out, a core part of the risk and reach report is assigning each county to a risk and reach level based on that particular data indicator. And because of how these risk and reach categorizations are calculated each year, it's not always advised to do a direct comparison of individual risk and reach level between the last report and this report. That's because all of the risk and reach calculations are done in kind of a vacuum of that year. They're all done by comparing all of the counties to one another using that year's particular data. So if we're doing maternal education, it's population and data all from 2016. If we're doing violence exposure, it's all population and violence exposure data from 2016. Same goes for 2019. And data has changed a lot since 2016. We've had a population decrease of young children, et cetera. So that means the benchmark that we use to calculate all of these risk and reach categorizations has changed from 2016 to 2019. So when doing direct comparisons for your county, it is very important to look at the individual county's rate, which is usually the second column in the data table in the report. That will give you the clearest picture of to make a comparison between the last report and this report. You could also say something like, under the conditions of 2016, my county was in the high moderate category, and under the conditions of 2019, we're in low moderate. But you do always have to have that different bench lines were used to make those calculations, knowledge under your belt. I'm around to answer any questions. I know that's a little confusing just to hear up front. So.
Hey, we got to get the nuance and the context in there. You know, all data has to be contextualized and explained. It's not just always straightforward. Okay, so here's the big reveal, right? Again, you know, I know in this field we're always like, so what's the bottom line? What difference is it making, right? So let's go and look at the first. So what we've done is we've taken each of the domains and we've looked at all of the indicators, and we have now been able to kind of come up with a little bit of a summary slide to help you understand what is the difference between 2016 and 2019 with respect to risk, and then I'll get to reach in a moment. So this slide shows you the risk indicators of family stability and whether we saw an increase or a decrease in the state rate for these indicators. In this report, you know, it's important to note we are only comparing data within a few years, 2 years, and we know that, you know, TTT, things take time, and it's also change is incremental. And we definitely encourage you to take a deeper look at the report, specifically, you know, at the state rates and the county rates to further explore this data. And I'll give you like a little sneak peek of a few of the maps, because again, you know, because we always got to do things big in Illinois. I don't want to, you know, have your eyes glaze over if we go through every single map here. You all know that one of our main messages has been that you look at the maps, sometimes you zoom out and you kind of just look at how the colors shift throughout the state. Sometimes you zoom in and you look at one county and you zone in, but I want to just orient you again to the map. So let's look at an example under family stability and specifically maternal education. So this is maternal education number and percent of births to moms age 20 and older without a high school diploma in 2018. You know, I think what's super important to note is maternal education can influence child outcomes, but it has nothing to do with a judgment on the mom's capacity to parent. All we're discussing when we're talking about maternal education is that lower educational levels are associated with low wage jobs without benefits, which can limit access to high quality early care and health services. It could mean that you may not have a stable employment, and you're likely to increase additional barriers with meeting your child's developmental needs. The state rate is 8.23% compared to 9.1% in 2016. And, you know, just to show you, again, you may recall from the last report, each of our maps is a heat map, and it illustrates the level of risk calculated for each county. There's 4 levels, as I mentioned before: low, low moderate, and high. To the left of the map are the ranges that are established for each risk level, which vary for each risk factor. To the right, you have the average of the county rates, which is something new that we've added, and it's determined by adding all available county rates and then dividing by the total count of those counties. And then you also have the state rate, which is obtained by dividing the number of cases by the total relevant population. So for example, in maternal education, it takes all of the instances of births to mothers without a diploma and divides that by the total number of children ages 0 to 5 in Illinois. The national rate is provided for some additional context. And then, of course, when available, we've included race and ethnicity data. And just to kind of give you a little bit of context in terms of why, and the race and ethnicity data is at the state level. And I think what's important when you look at that race and ethnicity data is that, you know, those little pyramids are not going to add up to 100% because we're looking within a racial or ethnic category, right? So what you see here, let's look, for example, at Latinx moms. Of the universe of Latinx moms, 20.47% are age 20 and above without a high school diploma. And, you know, what's important when we disaggregate by race ethnicity, you know, we start to then look into the experience based on your race ethnicity. And so, you know, it starts to drive you to different solutions that may be more targeted for different groups for various reasons. So like without adequate resources supports, Latinx moms may never be able to catch up to their peers when it comes to high school graduation rate. If you're not tailoring them deliberately for the population, there might be very specific strains on their ability to meet their educational goals that have to do with their economic status, that may have to do with if English is not their first language or family demands. So I just want to kind of point that out because the next example of a map is going to really punctuate why we look at this by race ethnicity as well. Let's go to the next slide so you can see the summary of the changes in the risk area of health. So you'll see here, it shows the risk indicators for health and whether we saw an increase or decrease in the state rate for these indicators. And, you know, again, noting we're looking at a couple years and things take time. You'll also notice that maternal morbidity is not included in this slide. It typically falls under health, but it's because in the time from when we first completed the report and now, or the first iteration of the Risk and Reach report, The definition of severe maternal morbidity has changed and actually caused the Illinois Department of Public Health to have to go back and recalibrate their data. So if we would have put that in here as a change, it wouldn't have been an apples to apples comparison. And of course, we want to make sure that we are transparent about that. But to kind of punctuate the point on maternal morbidity, I want to show you this map, because I think this is a perfect case study on the importance of disaggregating data by race ethnicity for two reasons, right? So this map here, what's super interesting that you'll note right away, the majority of it's white. It's not shaded in blue. It indicates in white indicates that there's no data available. So something to note there is that, you know, because severe maternal morbidity is a rare outcome, data were only available at the county level for 22 out of 102 counties, and that's 4 more counties since the last report. However, if it's such a rare outcome, it begs the question about when we disaggregate these data by race ethnicity. The data reveals that Black moms are experiencing severe maternal morbidity at 134 per 10,000 deliveries. That is almost twice the state rate. And so, it's really important to kind of note that. And it really gets us to an opportunity to have some pointed discussions about, why is this happening? And specifically to try to really, highlight and underscore the need to apply an anti-racist framework when we're thinking about maternal health and child health. And so just, I really wanted to kind of point that out. I think the other thing to just also note about how maternal morbidity is defined, these are unexpected outcomes, labor and delivery, that result in significant consequences to a woman's health up to 12 months postpartum. It doesn't include postpartum depression. And to align with the updated definition of severe maternal morbidity, blood transfusion is not included as a condition, and length of delivery hospital stay no longer determines instances of severe maternal morbidity. All right, let's move on here to the next set of changes, looking at our early care and education. So you see here the changes for early care and education indicators. And so super exciting that we saw decreases in risk for all 3 of them. So we know we are definitely moving in the right direction. And just to give you an example, one of the highlights of the slides, kindergarten readiness. So the number and percent of kindergarten students without demonstrated readiness for kindergarten, as defined by the Kindergarten Individual Development Survey, they did not meet the threshold in the 2019-2020 school year. We know that children entering kindergarten exhibiting the skills and abilities necessary for academic success in school are likely to stay on track and experience long-term academic positive outcomes. The state rate is 75.42% compared to 76.1% in 2017-2018, which I believe was the first year of implementation. ISB folks, correct me if I am wrong. So let's, just with that little bit that I showed you all, we have another poll. We'd like to, poll you. Where do you think change needs to happen most? At the local level, at the statewide level, at the funding distribution mechanisms, or if there's other, feel free to type it into the chat. And Linda, if you can indicate what the national rate that you are referencing so that we can make sure that we respond to what you are asking in the chat. All right, Luke, how are we doing on responses? Okay, almost half of the folks on here feel like we need to do focus our energy and attention at the state level. and then a third in terms of funding distribution mechanisms. Okay, the maternal slide. And if Keith, if you could, while I'm going through the rest of these, if you can respond to that, that would be fabulous. Okay, so let's go, keep on moving us along. So we're going to go into the REACH indicators. And so I wanted to point out to you and remind you again that, you know, all the REACH indicators have this base of the map. And this is our overall risk score, which assigns each county an overall risk level based on their average score across the individual risk indicators. So what we did is we added all the 15 indicators, and when a county lacked data for an indicator, that indicator was removed from the county's calculation of overall risk. And you have here all 15 of the indicators listed so that you know. We know risk travels in packs. They tend to kind of compound on top of each other. If your family is experiencing job loss or economic insecurity, there might be some challenges around stable and affordable housing. There might be some challenges around, exposure to violence. There can be, you know, your environment, the actual home that you live in may have environmental toxins, so on and so forth. So there could be a host of reasons, but we use this as the base map for our REACH map. So let's go to the REACH, and again, same kind of setup where we're just going to give you some highlights about the changes. As I mentioned before, you know, the REACH is publicly funded programs and services that support child well-being, and we selected 19 indicators representing public programs or services that support these positive outcomes. Again, organized by the 3 domains of family stability, health, early care, and education. And the advisory council selected based on 2 criteria. They needed to represent a policy lever, or lever, as some folks say, and they needed to correlate with mitigating the selected risk factors. So we're going to take you, through a couple of examples actually of the 2 new ones, because we figured folks might be the most interested in those. So let's move to the next slide here. So the 2 new ones that we added on is the Illinois Earned Income Tax Credit. And that was, there was some discussion in the advisory council to add this on because there might be some policy movement in terms of expanding this. And we wanted to see what the uptake is. And so what you see here is the EITC, Illinois Earned Income Tax Credit, claimed on individual tax returns for tax year 2018. The federal EITC is a benefit for eligible working people and has been shown to help transitioning families to be more economically stable and move on from living at the federal poverty line. The state EITC is 18% of the federal EITC. And this, as I mentioned, is a new indicator. And so I want to just point out, we weren't able to map this. This is in tabular format. And so we show individual income tax filers, EITC returns, and EITC returns claiming a child by county. So we can really get a sense and where we might need to move the needle in terms of, more families eligible, and making sure that they're taking advantage of this particular benefit. As I know there's been a huge push on another, tax credit that has to do with the number of children that you have at the federal level, the federal child tax credit. The first day of payments was just last week on July 15th. And the beauty of it is that if you've already filed your taxes, and you meet the income threshold, you are either receiving a paper check or a direct deposit, depending on how you receive your returns. And if you're a non-filer, you still can be eligible. So there's great ways that we are trying to, close the gap and foster some economic stability. Let's also look at one of the new REACH maps here, healthcare coverage. So this is the number and percent of children age 5 and under enrolled in Medicaid, which is the state, or all kids, I should say, the state children's health insurance program, as well as Medicaid and other public insurance in fiscal year 2019. We know that children with insurance are likely to have improved outcomes as adults for all the, wellness opportunities and, reducing risks of disease. And the state rate for publicly funded insurance is 37.87%. And so something to note, this includes the number of recipients who were enrolled in at least one day during a specified period. Partial and full benefit are also included. And, this was something that we thought about including last time, but because the state was doing such a good job, we didn't think it was necessary. But then in the production of that first report, it started to come out that we were slipping and losing our numbers. So we thought it would be good, and especially with COVID, we really think it's important, again, to highlight the importance of health and social determinants of health, this being one of them, access to high quality health care. So let's go to the changes in REACH within REACH indicators. And so family stability, this shows whether we saw an increase or decrease in the state rate. And we actually saw an increase in REACH in 4 of the indicators: income assistance, which is TANF, the temporary assistance for needy families, the child care subsidy, which is CCAP, the child care assistance program, the housing assistance at the federal level, and food assistance, which is SNAP, the supplementary nutritional assistance program, where we did see a decrease in REACH's permanency, and that you may recall me talking about that a little bit earlier when we were talking about the maltreatment indicator rate. So let's move on to the next slide here. This shows the changes in REACH regarding our health indicators. So there has been an increase in REACH with prenatal care, with immunization, with lead testing, all really important, and especially thinking through, how we mitigate some of the risk indicators around maternal morbidity, around blood levels, as well as preterm births. Now, there was a decrease in REACH with child nutrition. This is the WIC program, the Women and Infant and Children's Supplementary Nutritional Assistance Program. And so really, important to note here, and it's particularly, there's a trend that we constantly see with the drop-off. After the first year, eligible families do not take advantage of WIC, and they can go all the way up until a child is age 4. There's a decrease in the REACH in mental health services. So we know we need to do some significant investments, and actually the state has been taking those steps, particularly with investing federal funds from the Preschool Development Grant, Birth to 5, and expansion of infant early childhood mental health consultation, if we're not doing some of the more targeted, such as child-parent psychotherapy and other interventions here. So let's move on to the next set of changes. In REACH here, and sorry, I see a slight typo here, with changes in REACH in early care and education. And so you can see here that of the 7 indicators under REACH in early care and education, we've had some increase in REACH of the public distribution of home visiting and the reporting of developmental screenings, as well as early intervention and the early childhood special education that happens after a child ages out of early intervention, high quality childcare. So childcare availability for eligible children, but specifically childcare at the highest level of quality in our Accelerate quality rating improvement system, which is the gold level. So that's great, as well as an increase in expansion in the prevention initiatives. And we have had a decrease in the publicly funded preschool in terms of that REACH here, a decrease in the gap, that is, I should say. So data discussions. When we put out this report, we thought it was really important to provide people with some guiding questions. Because if our main message is, you need to take this data, digest it, but specifically in dialogue with local leadership so that you can make meaning of it. These are the questions that we have come up with, and we encourage you to come up with your own, but to kind of help guide how we look at these maps, and particularly when we're looking at all the maps in conjunction with each other, and if we're isolating just on a particular county, this can help guide the discussion. Furthermore, we put together a set of questions that specifically explore equity so that we can, be more deliberate about how we are designing solutions to foster greater racial equity. And so these questions are available as well for your discussions. And in particularly under here, we really want to drive down the who benefits and who is burdened by our current policies and systems in place, so that, again, we can name what's happening. And so I will just leave you all with some key messages here, and this isn't anything different than what we said the last round with the report. I mean, there's basically, the risk and reach report can break assumptions about what we think we know. Risk factors as well as strengths exist everywhere. It's not unique to one county, corner, region. And it's important to always remember that risk is situated in the environment, in the structures and systems, not the child or the family. The data provides a starting point for deeper conversations about barriers or lack of access to resources, and more importantly, about talking about how to secure support for children and resource allocation and systems alignment and coordination. And lastly, the local context provided by the people living and working in the communities where data collection happens is key to understanding what is happening and what needs to happen. There's a saying that the Lieutenant Governor always says is that the people closest to the problem usually have the best solutions for solving them. And so I know, I would be remiss if I didn't mention this, but, because a lot of folks are like, wait, but, that doesn't look like my community. Using county level data is blunt. It may not give all the nuance and context, hence why we highly recommend having these localized conversations. But if you want to access more precise data, ICAM is available to be able to provide you these data at, more smaller units of analysis so that you can really have a rich data discussion. And I'll just leave you with the link so that you can download the report and dive deeper into all of these maps and tables. And if you have any questions, please don't hesitate, to send us a note. And of course, we will try to answer anything that you have right now on deck. And so I will just hold off right now in terms of if there's any questions, because we're going to get into the fiscal scan, and then we'll have hopefully a few minutes at the end to respond to any questions.
Thank you, and good afternoon, everyone. I'm Mitchell Lifson with the YWCA Metropolitan Chicago. If we can go to the next slide. So far we've looked at the risk factors for children under the age of 6 and the programs and services designed to address those risk factors. And now we'll take a look at the price tag associated with those programs and services. Publication of the fiscal scan will go up online shortly, and in a few minutes we'll walk through some of the particular line items in each domain. But if we can go to the next slide, here's the big picture. The line items listed in the fiscal scan follow the programs and services chosen by the advisory committee, and when you put all the numbers together, nearly half of the expenditures are for health care, and over 1/3 for early care and education. Now, for purposes of the fiscal scan, we attempted to gather expenditure and appropriation information only with regards to children under the age of 6 or their parents. In a few minutes, I'll go into some of the limitations, but in short, if we were able to obtain the numbers, for example, for health care provided to the parents of children under the age of 6 in all kids, or certain federal tax data by age, some of these sections would have looked different. So it is a function of the programs chosen, and the data available. Over the period of time examined in this report, early childhood block grant funding increased. Child Care Assistance Program funding, in part due to increases in federal funding, went up. Enrollment in the state's major health insurance program for children, All Kids, went down, and the number of children under the age of 6 in substitute care went up. Next slide, please. Now, the baseline for much of the data is fiscal year 2019. This was done for several reasons. First, it matches the FY19 data in parts of the Risk and Reach report. Second, as you veer into fiscal year 2020, you begin to see line items that are influenced by the pandemic, which hit full force in the first quarter of calendar year 2020. The federal government has responded to the pandemic with a number of relief packages, the first of which it passed in the spring of 2020. The Families First Coronavirus Response Act, signed into law in March of 2020, allowed states to provide emergency supplemental benefits under the Supplemental Nutrition Assistance Program. Consequently, all Illinois residents enrolled in SNAP began receiving maximum benefits in April of that year. The same federal law also temporarily increased the matching share of state Medicaid costs, called the Federal Medical Assistance Percentage, or FMAP, to help states pay for increased healthcare costs associated with COVID-19. Another example, in June of 2020, Illinois approved an additional $500 stipend to individuals on the TANF program. In addition to increases in expenditures, some appropriations dropped in fiscal year 20 because there were fewer participants due to the pandemic. So the impacts of the pandemic will remain for a number of years, and part of the question for policymakers will be what year to use as a baseline in looking at future appropriation requests. Next slide, please. Again, the list of items encompass those programs and services chosen by the Risk and Reach Advisory Group. They represent a pretty good detailing of services to young children and their parents, but keep in mind there are some benefits and services not included that can impact a household. Generally, the examination is of state expenditures. This is partially because our reports are designed as a tool for state policymakers to use in considering further investments in young children. However, there are expenditures made by the federal government directly to local programs and individuals. The federal government directly funds Head Start and Early Head Start programs to either the funder or a local jurisdiction. And while the state helps issue the electronic benefit cards for the Supplemental Nutrition Assistance Program, the actual benefits come from the federal government. However, the advisory group felt that these are important programs that needed to be included in the full picture of investments, and thus they're listed in this report. As alluded to earlier, not in this report are investments local governments make in young children, whether that's from a county, a city, a school district, or park district, and that would alter the financial picture and possibly give rise to further questions of equity. According to the Education Commission of the states, local governments accounted for 13% of pre-K funding in 2018. The Fiscal Scan covers a timeline of actual expenditures in fiscal years 2018, 2019, and 2020, and then appropriations for fiscal year 2021. We felt it was important to use the actual expenditure numbers to show the actual investments. In addition, sometimes the appropriation line items are higher than what state officials actually intend to spend. This is because those line items may represent the authority to spend anticipated federal funds that the federal government has not yet approved due to differences in the state fiscal year and the federal fiscal year. Next slide, please. So just to illustrate that, the state fiscal year begins on July 1st of the year prior to the named fiscal year and ends June 30th of the following year. So, for example, state fiscal year 2020 runs from July 1st, 2021 to June 30th, 2022. By contrast, the federal fiscal year runs from October 1st of the prior year to September 30th of the named fiscal year. So federal fiscal year 2020 runs from October 1st, 2021 to September 30th, 2022. Now, granted, Congress regularly approves continuing resolutions, but with some uncertainty about the final federal numbers for the federal fiscal year, the state frequently puts in a number for a federal line item that may be slightly higher than what's anticipated. So when you see certain increases in the FY21 appropriation number, particularly if they are federal line items, read them with caution. Next slide, please. Now, as for what is a state fund and what is a federal fund, even if appropriated by the state, we went with the designation from the Governor's Office of Management and Budget. As a general rule, state general funds are those funds generated by the state individual and corporate income taxes, sales taxes, other taxes and fees. They can be used by the state for, as the name implies, most regular operating expenses. What we classify as state other funds are generally accounts restricted to revenue generated for a specific purpose. For example, a professional licensing fee to handle the administration of programs regulating that profession, but it may also include federal funds transferred into the account. Then there are the funds the state designates as federal funds, which usually are funds that can be used only for a specific program or service. So throughout this report, the data is meant to reflect expenditures on children under the age of 6 and their parents. In many cases, agencies were able to parse out the data from overall program expenditures, but in a number of cases, they could not do so. Consequently, some data was left out of the report, and in some cases, because children age 6 and under represented the bulk of those individuals served by the program, the full line item was included. As an example, the Child and Adult Care Food Program provides reimbursements for the provision of meals and snacks at child care institutions, family and group daycare homes, preschool programs, and before and after school programs. The program is administered by the State Board of Education, but ISB could not provide data broken out by age. But given how the program is crafted and the number of child care institutions involved, we included the number. On the other hand, the Family Care Assist Program provides medical care to parents of children enrolled in the state's All Kids Health Insurance Program. We could not obtain data related to just parents of children birthed to 5, and given the range of ages of children in All Kids, we did not include the line item in the fiscal scan. Now keep in mind that program spent $1.2 billion overall in fiscal year 2019. So even if just a third of that was attributed to households with children under the age of 6, it would alter the overall spending picture. Finally, there were other cases where we knew the number of children under the age of 6 participating in a program, but we didn't have the expenditure specifically tied to them. For example, we know the number of children birthed to age 5 involved in the SNAP program. Those benefits come from the federal government. Thus, we used a formula incorporating total participation to approximate SNAP expenditures for children under the age of 6. Next slide, please. Now, as you look at the expenditure and appropriation numbers, keep in mind it's not just the dollar amount, but also how the state distributes those funds throughout the state. In some cases, organizations need to submit a proposal to the state. In some cases, funds flow through local governments, and in some cases, individuals need to sign up for the programs. That can well impact the reach data you see in the risk and reach report, and given the risk data should also bring into consideration the questions of whether the manner for distributing funds meets the needs of children across the state. Next slide, please. So as I mentioned, 2019 is the basis for the fiscal scan. And as you look at the report itself, you'll be able to see a breakout for each domain. Next slide, please. And when we put everything together, the total expenditures outlined in this report for fiscal year 2019 amount to just under $4.4 billion. Of that amount, $3.6 billion is in state and federal funds allocated by the state of Illinois, and $700 $247 million comes directly from the federal government. Of the state appropriated funds, the amount spent on families with young children represents 5.5% of the state operating funds expended in fiscal year 2019. Now that amount is above what we depicted in our last report for fiscal year 2018, but keep in mind that while there were some increases in some line items, we also did not include the state earned income tax credit in the last report. Next slide, please. Again, this slide indicates the share of expenditures on programs serving young children and their families compared to the total state operating budget. Now, the general funds budget, including additional transfers and debt service for fiscal year 2019, was $40.3 billion. So if you measured the expenditures on young children and their parents against that, the percentage is closer to 9%. Next slide, please. All right, let's delve into some of the sections. For early care and education, you can see that the expenditures on preschool and the prevention initiative represent just under a third of the costs. But if you add in Head Start expenditures, early education and the prevention initiative comprise more than 50% of the expenditures in this category. Childcare makes up just under 1/3. Home visiting is a small part of the pie here, but as many of you know, Governor Pritzker announced in early 2020, pre-pandemic, that he wanted to expand home visiting programs statewide. Next slide, please. Here you can see the increases in early childhood education. In fiscal year 2019, there were more proposals than available for funding under the Early Childhood Block Grant Program, and the Department of Human Services added in $6.4 million to the program. The Department of Human Services was able to provide us with total child care assistance program funds spent for children under the age of 6. You can see the increase here. While they could not break out source funding within this age range, if you go to the next slide, you'll see how the federal line item has increased over time. We completed the data on this report prior to the General Assembly approving a budget in late May, which included supplemental funding for fiscal year 21. And I just want to touch on that a bit here because there is a significant level of funding the state received under coronavirus relief packages. For fiscal year 21, there was first from the December relief package, an additional $350 million. Then on top of that, in the spring, additional funding for child care stabilization, as well as under the Child Care Development Block Grant Program, totaling $1.3 billion. That amount is also reappropriated in fiscal year 22. A significant portion, as you can see, is for stabilization of the child care sector. But if you go to the next slide, you can also see how funds will be utilized to reduce family payments to $1 per month for families with incomes at or below 100% of the federal poverty level, cap family payments at 7% of family income, setting the exit level for the program at 250% versus 225% of the federal poverty level, and increasing reimbursement rates for providers. Next slide, please. Now let's go to the healthcare portion of the scan. The bulk of the expenditures in this domain are for the All Kids Health Insurance Program. And if we go to the next slide, you can see the expenditure breakout for the program. The bulk is for inpatient care, and the majority of the 25% listed as other is clinic care. But what you'll also notice here is the relatively small portion spent on mental health services and dental care. You'll also see a decline in enrollment. Some of that might be related to an improving economy during this time period, but I'll also note that in late 2017, the state switched to a new computer system that impacted families in a negative fashion regarding eligibility for some of the Illinois Medicaid programs. Next slide, please. As noted previously, there's also been a decline in another program, WIC, and that follows a national trend. As many of you know, the Women, Infants, and Children program provides food, nutrition education, breastfeeding support, and referrals to healthcare and social services for low-income pregnant women and then parents with infants and children under the age of 5. It's an extremely important program when it comes to the health of young mothers and children, yet not only is there a decline seen here, but from February of last year to this year, during the height of the pandemic, WIC participation increased by only 2% nationally. And according to a report published by the U.S. Department of Agriculture, only 45 to 50% of individuals eligible for WIC coverage were participating in the program in 2018. So the question here is not how the state is distributing funds, but how are we making women aware of their eligibility for the program and signing them up? Next slide, please. Finally, we have the family stability section, which includes programs run by DCFS and economic supports that include income assistance through the Temporary Assistance to Needy Families program and food assistance through the SNAP program. We also added this year expenditures related to the state earned income tax program. As you can see, the economic supports make up the bulk of this category, and within that, the major expenditure is for SNAP. Next slide, please. As I mentioned, we included the state EITC here because of the important role that it plays in the economic security of low and middle income families. Of the 6.3 million state tax returns filed, more than 900,000 claimed the state EITC, and of that number, just under a third had children under the age of 6 in the household. Now, we could not secure from publicly available federal tax information data for an accurate picture of Illinois households claiming the federal EITC, but we can say that studies have shown the use of money gained through the EITC goes for basic household needs and helps families save for an education or home ownership. Next slide, please. Also, as referenced early, and as many of you are aware, this year there was a 1-year increase in the federal child tax credit. And as also referenced, starting this month, the federal government began implementing a provision that advances for each of the final 6 months of the year part of that credit. It is an important step, and these are increases that should become permanent. But even at the lower credit level in 2018, 1.6 million Illinois tax filers claimed a child or other dependent federal tax credit. Again, an economic lift for not only current needs, but a measure that helps improve a child's health and education. Next slide, please. Here you can see the change in enrollment under the SNAP program, and what is the instructive point here is that for June 2020, you can see the dramatic increase as the pandemic took hold. Next slide, please. The Illinois Department of Children and Family Services was able to pull data on expenditures for children under the age of 6. That was where the electronic records permitted it. So it does not include all expenditures, but you can see the trend line increasing. Recognizing that following a review of operations, the state committed to stepping up funding for the agency to help reduce caseloads for workers, increase coordination among divisions, and embark on other improvements. But there was one other item that may be driving the increase, and that is an increasing caseload. Next slide, please. Here, for example, you can see even before the pandemic, the caseload for children under the age of 6 in substitute care increased. The opioid epidemic was likely just one of the factors that contributed to this increase. Next slide, please. So to come full circle, how should you use the Risk and Reach report and the Fiscal Scan? Many of you are aware of the work conducted in 2020 by the Governor's Commission on Equitable Early Childhood Education and Care Funding, and by its own admission, it was looking at just one element of the early childhood system. With the 2 reports, we've taken a look at the wider sphere that takes into account not just early care and education, but healthcare, economic supports, family supports through DCFS and other areas. They are all interrelated, and the question here is, where are the greatest needs and what might have the greatest impact? Next slide, please. And speaking of impact, we obviously need to be cognizant of the point in time we are in and COVID-19. What should be our baseline going forward? In what ways and for how long might we need to fund programs to deal with a year at home for children who are not in school, whether that was pre-K or K through 12? What about the lingering health impacts for individuals from COVID-19 and the strains put on the public health system? And finally, what about the emotional needs for children resulting from the loss of parents and grandparents? I will not claim the Fiscal Scan has all of the answers, but hopefully it can contribute to the dialogue going forward. So now we'll put you all to the test. If you go to the next slide, you can answer this question in the chat box. If you had $1 more to spend, where would you allocate it? In the family stability domain, health, or early care and education? And if you'd like, along with choosing your domain, please tell us what program specifically you would have it go towards. All right, we have 4 respondents. It is increasing here, but it appears that we have 4 responses for early care and education and 2 for family stability. And Christina, I will turn it back over to you for further questions and conversation.
All right, sorry, I was on mute a little bit longer. Looking to see here, it seems like for the most part, folks are responding in terms of early care and education, family stability. Interestingly, people are partial to the 2 domains that have the smaller proportion of the investment. It seems like folks are relatively satisfied at some point, to some degree, with the health. So we'd like to open it up right now. It seems like we had some clarification in terms of the health coverage. It seems as though there was a question here in terms of the increase in slots, availability for high quality early childhood education program. Would be interesting to see how much those numbers have changed due to permanent center closures and capacity loss resulting from the pandemic. Yes, definitely. That seems like a very interesting side study that could emerge from this as well. And then looking, okay, Linda, I hear you. You're not satisfied with health in terms of the chat. That's fair. But I just want to open it up, at this point, if folks have questions, we are totally open to you unmuting yourself, or even if you have comments or clarifications. We plan to do, just so you know, we have a couple other types of trainings and webinars planned. One would be a train the trainer on the kind of top line messages that come out of this report, and also helping to explain the report so that when you do have questions for, or when you plan to host discussions and conversations at a local level, you'll be able to, facilitate those conversations. We don't expect you to be an expert, but you will be able to kind of speak to kind of the generalizations that we are advancing around this. We also plan to do some deep dives on some of the domains. We did that the last round, and we found that people really appreciated, like, when we went deep into health, when we went deep into early care and education, when we went deep into family stability. And usually for those sessions, we bring in our advisory council members who have expertise in that particular area. And then, of course, we are looking to have a deeper conversation with our friends at GOECD, as well as out of the governor's, the early childhood transformation team about these data and how that may inform how we go about moving forward with the recommendations from the Funding Commission. So with that, Ariana, I see you agree, not necessarily sad, but you believe NEC can be preventative. Indeed. I mean, health and early care and education, they go hand in hand, right? Health and education outcomes. That's what the whole social determinants of health and all the studies around that really point to. But if there are no questions, or do I see any hands? Let me try to look through my screen here. All right, and it seems as though I just want to make sure if I'm missing anything, Luke, Veronica, in terms of did we respond to all the questions in the chat?
Yep.
We're looking good. All right, folks, I mean, you know, if we don't have questions, I'm all about giving you time back. We don't have to drag this on out. You can have 7 minutes back of your life. I really appreciate everyone coming through to kind of, you know, share with us in the big reveal of the second edition of the Risk and Reach report. You will be able to download the report right now in its PDF format, and shortly in the next few weeks, we hope to have the interactive website up so that you can play with indicators looking at various combinations of risk and reach, not just the overall risk score and then overlaying with the reach. So you'll be able to do that. And then, of course, you know, we are here to entertain your inquiries, your questions, if you want a presentation. But we are certainly about capacity building. We need more soldiers in this work to be able to talk about this. And of course, I'm always looking at this through the lens of my new hat in the Senate and thinking about how do we even translate this to be in the legislator ease so we can make this actionable. So we're also looking to design a couple of webinars specifically for legislative staff and the budget staff because now that I'm on the inside, I see how much influence they actually have in this particular work. And, you know, I'm about trying to get that, make everybody an early childhood convert. How can we get more school and admin piece here? I think that can be done. Actually, we can talk to your boss about getting this into the weekly, communication and pushing that out there. And we can talk to my former colleagues on the Board of Education to say, this is the most important report around, and we need to see more of our people here. So if you can help me and co-conspire in that, I would totally appreciate that.
Anything for you, Senator. Anything.
All right, everyone, have a beautiful rest of your day. Thank you again for joining us, and we will be in touch with more opportunities to go deep into this report. And I'd like to once again thank the colleagues at Voices, empowered by YWCA Metropolitan Chicago, as well as ICAM, as well as the fabulous funders who brought us the resources. Thanks everyone for hanging out and all of your work, and hope everyone has the rest of the week is easy going. You get some rest and relaxation, and hug and kiss some babies while you're at it too. All right, take care.